Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento de estar aquí contigo. Hoy nuestra lección es la presión alta e hipertensión en español. So today our lesson is talking about high blood pressure, hypertension in Spanish. We're going to do a handful of things. We'll start with some relevant vocabulary and then we'll talk about how to take a blood pressure, talk through the steps in Spanish, give results, talk about the relationship between diet and exercise on blood pressure, medications, the risks of not controlling your blood pressure, and then we'll finish with some conversational prompts for you and your conversation partner to practice some of this. Let's get started with vocabulario relevante de la presión. So first of all, blood pressure. We've got la presión arterial, la presión sanguínea. All of these three words are fine ways to say blood pressure. Most people just refer to it as la presión. El manguito de presión is your blood pressure cuff. There is a word for a sphygmomanometer, but you probably don't even say it that much in English. Una presión saludable, a healthy blood pressure, between 60 y 80, or 100 y 120, or something like that, okay? Más de, more than, menos de, less than, hipertenso, hipertensa is the adjective hypertensive, prehipertenso, prehipertensa, prehypertensive. Checar la presión. Checar wasn't always a verb in Spanish, but over the years, with the relationship between Spanish and English, checar is a great verb for just checking. Checar la presión, okay? Tomar la presión. If you don't like checar, if it sounds too Spanglish for you, go with tomar, tomarle la presión. Padecer de la presión. Padecer is a verb that doesn't look like much in English, but it's to suffer or to have something chronically over the course of time. And so, padecer de la presión, you can padecer de diabetes, padecer del corazón, padecer de whatever it might be. But padecer de la presión is essentially to have high blood pressure. Okay, let's take a look at some instrucciones específicas when it comes to taking someone's blood pressure. Okay, voy a tomarle la presión. Hey, I'm going to take your blood pressure. Siéntese, por favor. Take a seat, please. Quítese el suéter, la chaqueta. Take off your sweater, your jacket, por favor. Présteme su brazo. Hey, would you allow me your arm, or can I, have your arm here? Or ponga su brazo aquí. Put your arm here. Ponga sus dos pies en el piso. So put your 2 feet on the floor. Relájese, relax. No cruce las piernas. Don't cross your legs, okay? All right, so we've taken the blood pressure. Now let's talk resultados. Su presión está en, it's essentially saying your blood pressure is, su presión está en 100. Let's go through some top numbers first. 100, 110, 120, we're happy up until now, right? 130, 140, 150, 160, 170, 180, 190, ay, 200. Híjole, sobre is our word for over. Sobre 76, maybe, 76, or 88. Notice when we have our hundreds and our tens, it's just the hundreds word and then the tens word. But now between our tens and our ones, we've got y. So it's 76, okay? 88, 94, 102. Okay, so between our hundreds and our ones, no y. Just between the tens and the ones, we have an e when we talk numbers. So 102, okay? Es normal, that's normal. Es baja, it's low. Es alta, it's high. Okay? Bien, so your frase is, su presión está en 120 sobre 76. Es normal. Okay? Perfecto. Su presión está en 100 sobre, maybe we should have put 66 there, 66. 66. Es baja. Perfecto. Ok, muy bien. Explicando la presión. As you're talking about what blood pressure is, we could talk about a handful of things. Some of this you may just want to skip over because you don't want to get in the weeds. But if you want the detail, here it is. La presión arterial nos dice cuánta fuerza, tells us how much force, o presión, los vasos sanguíneos, your blood vessels, las arterias, sienten en dos momentos. So how much pressure they feel in two different moments. Primero, con cada latido del corazón, with each beat of the heart, el número alto, la presión sistólica. Y entre latidos, and between beats, cuando el corazón descansa, when your heart is resting, el número bajo, presión diastólica. Una presión saludable, a healthy blood pressure, es una presión sistólica menos de 120 y una presión diastólica menos de 80. Es decir, una presión menos de 120, and what's the slash? Sobre 80. All right, presión alta puede causarle, can cause for you problemas a lo largo, over the long run, si es más de 140 sobre 90. Es importante chequear is another verb to check. Chequear la presión frecuentemente porque no puedes sentir la presión alta, no causa síntomas. So here we're saying it's important to check your blood pressure frequently because you can't feel high blood pressure. It doesn't cause symptoms until it's too late, baby. All right, la dieta y la presión. What's the relation between la dieta y la presión? ¿Cómo es su dieta, you might ask, starting out, open-ended question. What's your diet like? ¿Qué le gusta comer? What do you like to eat? Una dieta balanceada. Una dieta balanceada is a good way to talk about a balanced diet. Or una dieta saludable, a healthy diet. La sal, salt, or sal de mesa, so table salt. El sodio, sodium. Comidas procesadas, so processed foods. Comidas enlatadas, canned foods. Comidas rápidas, fast foods. Carne roja, red meat, or carne de res, beef. Fumar, to smoke. Tomar alcohol, to drink. Comidas altas en potasio, for example, banana, aguacate, melón, tomate, frijoles. So foods that are high in potassium, examples here. So we've got banana, aguacate, avocado. Melón is cantaloupe. Tomate, tomatoes, frijoles, beans. Avena, oatmeal. Okay. Hojas verdes, so green leafy vegetables, see? Comidas bajas en sal, or bajas en sodio. Cafeína, caffeine. Alcohol, and alcohol. Okay, all right, so we could put some of this vocabulario into some recomendaciones sencillas, some simple recommendations. No agregue, don't add. No agregue sal a las comidas en la mesa. So don't add salt to your foods at the table. Limite el consumo de alcohol. So limit your alcohol consumption. Prepare sus comidas en la casa en vez de comer en la calle, in restaurantes or afuera. So make your meals at home instead of eating out. Mm-hmm. Okay. Actividad física y la presión. Of course, with that diet stuff, you could have all sorts of recommendations, right? And there's plenty of vocab on that slide for you to work with additional recomendaciones. Actividad física y la presión. La actividad física regular, so regular physical activity, es importante para mantener una presión saludable. It's important to maintain a healthy blood pressure. So you could talk about a número de veces por semana. 5 veces por semana, maybe. Notice veces is our word for times in Spanish when it comes to occurrences. You would never say tiempos por semana, okay? So por 30 minutos cada vez, maybe. So for 30 minutes each time. Hacer ejercicio is the verb to exercise. ¿Qué le gusta hacer para la actividad física? What do you like to do for physical activity? Here are some examples. Andar en bicicleta, ride a bike. Bailar, dance. Caminar, walk. Correr, run. Ir al gimnasio, go to the gym. Jugar al fútbol o soccer, ¿sí? So play soccer. Jugar con los niños, play with the kids en vez de mirarlos, instead of watching them. nadar, swim, usar las escaleras en vez del ascensor. So using the stairs instead of the elevator. Okay, let's talk about medicamentos para la presión. Los medicamentos. Controlar la presión is the same as saying llevar buen control de la presión. So we talk about, just maintaining a healthy blood pressure, controlling your blood pressure. So we've got pastillas, píldoras, tabletas, medicamentos, medicina, medicación. They're all básicamente sinónimos here. Diuréticos. We've got diuréticos like la hidroclorotiazida. Hidroclorotiazida. When you have big words like that, you just kind of take them syllable by syllable. Hidroclorotiazida. Okay? Para eliminar el agua, so to eliminate the water or get rid of the water, bajan el volumen de sangre en el sistema. So they lower the volume of blood in your system. Inhibidores ACE, like lisinopril. Para dilatar or abrir los vasos sanguíneos, so to open your blood vessels, resulta en una presión más baja, so it results in a lower blood pressure. Y luego tenemos bloqueadores de calcio, like amlodipina, ayudan al corazón latir con menos fuerza. So these help your heart beat with less force. Okay, bien, there are probably other clases de medicamentos para la hipertensión, but these are a handful that we could talk about y son comunes, ¿verdad? All right, let's look at a formula that you can implement to talk about instrucciones with medicamentos. Instrucciones, here's what we're going to do. We're going to take some simple instructions and we'll talk about a quantity of medicamentos and then we'll talk about the frequency of how you take them. This is pretty formulaic. You can plug and play as you wish. Okay, so hay que tomar, maybe, necesita tomar, tiene que tomar, debe tomar. Okay, so these are all really easy. Hay que tomar essentially means you have to or you must. Necesita tomar, you need to. Tiene que is literally, and even in the English structure, you have to take. Debe tomar, you should take. All of these are great because tomar, your verb, you're not actually using the command tense, you're just using some present tense verbs here. Hay que tomar, necesita tomar, tiene que tomar, debe tomar. Let's talk quantities now. Una pastilla, maybe one pill. Dos pastillas, two pills. Or if you want to talk about miligramos, any número de miligramos, okay? And frecuencia, todos los días, every day. Una vez al día, once a day. Cada 8 horas or cada 12 horas, every 8 hours or every 12 hours. En la mañana, in the mornings. Antes de comer, before eating. Con comidas, with meals. Al acostarse, at bedtime. Okay, so you could look up some other frequencies if you needed to say something separate, but feel free to use this sort of formula to give a really simple instruction. Not only is it simple, but it's really clear as well. Okay, hablamos sobre los posibles efectos secundarios de los medicamentos. Posibles efectos secundarios. Es posible tener, it's possible to have, es normal tener, it's normal to have, puede tener, you can have, diarrea, dolor de cabeza, headache, dolor de estómago, stomachache, estreñimiento, constipation, hinchazón en, swelling in, hinchazón en los pies, your feet, los tobillos, your ankles, las piernas, your legs, mareo, dizziness, náusea, nausea, pérdida de apetito, so loss of appetite, falta de apetito, similar but slightly different, lack of appetite, loss of appetite, lack of appetite. You can use these two actually with other things as well. Pérdida de sensación, so sensation, so like loss of feeling. Falta de sensación, lack of feeling, okay? Or pérdida de conocimiento, loss of consciousness. So you could use pérdida de, falta de in other contextos también. Sueño, so sleepiness, okay? Tos, cough, vómito, vomit, okay? All right, getting to complicaciones de no tomar o no controlar la presión. Complicaciones. Si no controla la presión, if you don't control your blood pressure, puede llegar a tener problemas graves a lo largo. You can llegar a tener, it's kind of, I guess the best equivalent would be like develop or have over time. Llegar a tener problemas graves, so graves, serious problems. Puede desarrollar otras condiciones. You can develop other conditions too. Aunque no siente los síntomas, even though you don't feel the symptoms de la presión, causa problemas. It causes problems. Por eso es importante un buen control de la presión. Por eso es importante un buen control de la presión. That's why it's important to have, to be on top of your blood pressure, basically. Let's talk complicaciones específicas. Maybe ataque de corazón, heart attack. Derrame cerebral is a good word for stroke. Disfunción sexual, okay, obvious. Enfermedad renal, so kidney disease. Insuficiencia. Insuficiencia is how we say in Spanish failure. So like insuficiencia cardíaca, heart failure. Insuficiencia renal, kidney failure. Okay, pérdida de visión, loss of vision. Okay, you can think of other complicaciones específicas también. But we've got enough to actually begin putting some of this stuff into practice. So, para conversar con su compañero, to chat with your partner. So use slides 3 through 4. Make sure you get the download here. If you're watching this on YouTube, head over to the blog post so you can get the download. If you're on YouTube, make sure you like the video if you're learning something new today, and subscribe to our channel so you can get more regular video viernes lessons. But use slides 3 to 4. Download, print off this the handout, and use slides 3 and 4 to talk through your partner's blood pressure and give the results. Okay. Use slide 5 then to explain healthy ranges of blood pressure to your partner. Use slides 6 through 8 to talk about the relationship between diet, physical activity, and blood pressure. And then use slides 9 through 11 to discuss medications for your patient. And use slides 12 and 13 then to discuss the risks of not controlling their blood pressure. All right, so preguntas. If you have preguntas, post them down below in the comment section. If you're on YouTube, awesome, post them there. If you're on the blog, great, just scroll down and you can post your comments below. If you need a conversation partner, head over to the Learning Medical Spanish Facebook group. That's why we created it. It's a community of, 5,000 something subscribers, healthcare workers, people working on their Spanish. So head over there and jump in and become a member and put yourself out there and say, hey, I'm a nurse, I'm a physician, I'm about beginner, intermediate, advanced level. I'm looking for a conversation partner. Anyone want to practice with me? And use the notes to have some conversation with them. Great. All right, muy bien. Muchas gracias por aprender español conmigo. Juntos mejoramos comunidades. Together we really do improve communities. Para más español, head over to the website, commongroundinternational.com. And if you want to take a free medical Spanish terminology test, you can take as many as you want. Just sign up for your free account at certifiedspanish.com, and you can take as many medical terminology tests if you want. All right, muy bien. Excelente. Thanks for joining me today. Be sure to like the video and subscribe to our channel on YouTube so you can get more medical Spanish lessons for free. Ciao, amigos.